Hey, Dave, I
General.
can hear you. I'm up. Doing okay?
Hey, how are you?
I'm good. I'm practice full social distance. I'm outside.
Hey, thanks for taking the time to be with us, General. We really appreciate it. I just gave a background a little bit on the importance of Fort Jackson in this community and the amount of just the economic impact that y'all have. I know y'all have had some trying last 3 weeks. You want to give us a quick update on what you're seeing out of Jackson and how y'all are practicing your social distancing while training so many soldiers?
Yeah. So when you say quick, give me a number on quick, and then I'll stop at some point and then wait for questions. But I could give you a 5-minute spiel. I think cover everything, and just kind of loop back
Perfect.
wherever you got questions or wherever I got gaps.
You got it. Go for it.
Okay. So just let me to everybody out there. Hello, first of all, and a great day to be in South Carolina. Great day to be in Columbia. And then what I would tell you, the only thing I was told when I took command of Fort Jackson from a 4-star general was the fact that the Army goes however Fort Jackson goes, and that is very true. Was sitting here today at Fort Jackson for a lot of you, and this is the first time any of you've heard this or know about it, is 60 Minutes. So 60 Minutes is here today. They'll be here tomorrow, but it's a good news story in terms of what we've got going on for the Army and what we're doing for our Army, because we produce over 50% of the males that join the Army come through Fort Jackson. Over 60% of the females that join the Army come to Fort Jackson. So for us to do what we do at scale in this new environment, the COVID environment, and as we like to call it now, the social distance training environment, and be able to continue our mission is absolutely phenomenal. And I think I may have just dropped off.
You're good. No, we got
I'm good.
you.
Okay. All right. You got me. Okay. Dealing with new technology. But dealing in this social distance training environment, as we call it now, is it's a challenge, but it's a threat, and we always know we have to be ready for our nation. Our nation is never going to ask us if we're ready. It's going to be expected. So whatever threat comes up, we have to deal with it, and we're demonstrating that. Dave, as you highlighted, there have been some rough spots, but from day one, we said it was never a matter of if, it's a matter of when. And COVID doesn't care what you look like, what you drive, what uniform you wear, or what type tie you wear. COVID's coming. So we knew that going in, and part of our mantra was, go ugly early. So we went very fast, very aggressive. We had a lot of conversations with those that were experiencing it, probably about 3 or 4 weeks ahead of us, your Koreas, your Italys, and just kind of getting their playbook on what they were doing, things that they were seeing. And we leveraged that very quickly, very early on. And our 3 key, approaches were prevent, detect, and contain. And that has really been our guide all the way through. And when I tell folks about prevention, it really is nothing more than changing habits, behaviors, and attitudes. And then everything else should flow from there. I will also tell you that since this started about 2-3 weeks ago, we had 12,000 soldiers in training. This week, we've got 9,000 because we've been soldiers out. He came to Jackson and said, hey, can you guys do a pilot where you're going to demonstrate secure, sterile, and safe transportation from one installation to another without further proliferating COVID-19? And absolutely, you don't get a vote in that. You just kind of say yes, sir, and you move out. So we did, and then we were able to move to date, over 2,000 soldiers to different locations without a single case of COVID, and that opened the door for everybody else, and for our entire enterprise. That opened the door not only for us to ship to AIT locations, but for AIT locations to then demonstrate they could ship to first units, your Fort Braggs, your Fort Stewarts, all those first units that inherit soldiers that we train here. So it created the momentum within the pipeline to get everything going. The only thing that's happened within the last 2 weeks is a Department of Defense order to stop shipping new recruits to us, to all the basic training locations. But that was to enable everybody to recalibrate themselves, relook at their measures, put everything in place. So now the full pipeline we can receive, we can ship, and oh, by the way, not further proliferate the spread of COVID-19 or contain it if we get it on any particular installation. So we've only done that by ground. Over the next couple of weeks, we'll do that by air, and then we'll demonstrate that as well, and we'll be able to ship more to those distant locations. So really quickly to go through just some key things, our training model has changed. Basic training is still 10 weeks, but now we do 2+8. So the first 2 weeks is what we call control monitoring, or a common term for it would be quarantine. So they're quarantined, they still train, but not to the extent that we normally would in the first 2 weeks. They're contained in their unit area, They don't go anywhere outside of their unit area, and they get a lot of classroom type training, and it's all at social distance. The only minor problem we've had is, given when COVID arrived, we were in the middle of having very big field loads, as we refer to them. But the Army and TRADOC has since said, Training and Doctrine Command, we reduce that load, so 50% or less. So now with the soldiers that we have coming in, it's at that 50% mark that are coming in. So that enables us to do social distancing a lot better than when you have a much higher capacity here on hand. General notes, I issued a public health emergency on 27 March, and all that does is enable me to have the right authorities to ensure compliance and enforce the things that I need to on the installation, which has worked very well. A lot of folks don't like change. A lot of people are uncomfortable with a lot of the changes, but they know they're necessary, which included limited access. So we're down to just the mission essential things that we need. We do have some contract work that continues to go on installation. Some of those contracted elements that are doing work here have opted out on their own, and that's okay. We totally understand that. But others that can, and given what they do, it's totally acceptable for them to come in. Everybody that comes onto Fort Jackson right now is screened. You get a temperature check and you get a screen coming onto the installation, regardless of who you are, regardless of what your business is, but you're going to be screened when you come in. And at various locations where we do public, anything public, you're screened there as well, to include like my headquarters. We're fully into the face protection. Every soldier has face coverings that they use. We had a lot of donations come in, but we also repurposed our tailoring shop that usually makes and tailors the Army service uniform. They repurposed to make face coverings. And so they turn that at roughly, 150 to 200 per day, not only for soldiers, but also for the workforce. So again, it's just being innovative across installation. And Dave, I'll hold with that and see if there's any other, points to bring up. I've got plenty, and I'm all in for all questions.
That's good information. A lot of good troops, and I'm glad you got some TV cameras following you today. That's good stuff. Couple questions for you. As going through, and you've already got a couple thousand troops out, and you said all by ground transportation. Going forward, using CAE to get some troops out?
That's correct. So it'll be contracted air is the term.
Contract
so
air.
Essentially, we contracted. Yep. So contract air coming through. It may not be, and it's kind of like we do on deployment. So you may soldiers in the terminal, but directly from bus to aircraft, and then they go. And that's part of what the Army wants to continue with, that secure, sterile transportation. If we know they're good when they leave here, they're good. They've been in the safe bubble, as we call it. So no external contact from them from one transportation means to the next, and then that's a secure handoff to when they arrive.
Great. Let's pivot just 1 second, General, and let's talk about what you've got a significant responsibility with all the troops, but also the folks that live and work on post, and so you've trying to manage visitors on the installation. Can you address that? What precautions y'all put in place for folks, retirees or general public going on post?
Yeah, so 2 points on that one. The first thing we did, and we did this many weeks ago, probably about 4 weeks ago now, as soon as we know we were even going to get close to COVID, and with the recruits that were coming in and where they were coming in from, we went to 30% telework with the workforce, because priority number one is protect the force. We protect our mission. Well, 70% of our force lives off the installation. They live in our local community. So 30% of the workforce immediately went to telework. I put another 30% on top of that and what we term a reserve capacity. So they're just reserved. Nothing's wrong with them. We do need them, but we put them in a reserve capacity in case things were to go south. Then we have a bench to draw from, and we don't have more people getting contaminated or getting infected with COVID-19. With regard to the restrictions on the retiree population, we have Moncrief Medical Home, which is on Pinnacle Drive, which we knew we had that as a point to leverage with the pharmacy care and physician assistance care, all those type things off the installation. So we shifted additional resources there so that they would not have to come on installation for refills, appointments, those type things. And then we limited the days to 2 days a week, Tuesday and Friday. And the key reason behind that, We still do graduations. The soldiers that do graduate have access, local post passes Wednesday, Thursday, and you don't want those two vulnerable populations to come in contact with each other, whether it be at the PX or it be somewhere around the clinic. We separated, in time and space, those two populations, making sure we even further reduce that risk of those populations coming in contact, because that retiree population is typically going to be over 60 plus. And then with the trainees themselves, you don't want any, cross-pollination, cross-contamination, and that gets back and it will spread very rapidly in the barracks areas.
Good points. Let me just interject there. If anyone has any questions for General Beagle, certainly I think there's a place to raise your hand or type it in the chat button at the bottom of the page. We'd love to answer any questions you may have for General Beagle, and I'll take those as they come in. General, as part of the Army's philosophy is adapting and overcoming and just always monitoring the situation. How, no one could predict this. Maybe the Army has, quite frankly, but otherwise, none of us have predicted this type of change and interruption of our daily habits. What is this teaching you as a officer, but also what are you using this? How are you using this to teach your soldiers?
Yeah, so great question. And there's several lessons, that we're learning. In some cases, we're relearning. And so if you read our leader, our newspaper, you can get it online this week. I wrote an article in it, and the title of it is What We're Learning and What We're Relearning. In a lot of cases, there's things that we already know, but we're relearning. And one is you have to do less with less. A lot of people like to say, do more with less. I don't really believe in that, but you do less with less. So all of our workforce reductions, all those type things, it proves a point. You can't do more with less. You only do less with less, but the less you do, you have to do it better. And we're doing that. We're down to mission essential, only those things that we need to do. And oh, by the way, the goodness is the mission continues. We can still train and do what we need to do for our Army and for our nation. The other, lesson learned is you have to operate at the speed of change. If you don't, you're irrelevant. And so if you're not ahead of it, the one thing I've clearly learned is my decisions. I'm never going to make a perfect decision, but at the end of the day, I want a decision that's more right than it is wrong. And even when you make those decisions real time or ahead of time, they don't look right to everyone else. Until later on, it's like, oh, that was a great idea. Well, it wasn't so popular, it wasn't so great 2 weeks ago, but now it's a great thing. But you have to operate at that pace, that speed of change. Otherwise, you're late. And in this fight with COVID, you're either going to be ahead or behind. And we're just trying every day to just stay ahead. Even if it's by inches, we're ahead. And that's where we want to be and stay.
Great point. Anybody, I'm looking around here, seeing if there's any questions for the General. Good takeaways. I'm going to look at the leader myself to read your article. I'm not seeing, General, I don't want to keep you because I know you got thousands of things to do today, but what's your takeaway as far as, obviously we're all waiting to see the economy recover and everybody get back to whatever the new norm will be. Are y'all looking out for the summer to see when graduations may or be back to normal, or y'all going to take that, take your orders from DOD, but any thoughts on that?
Yeah, and so we're looking out. I mean, actually, I'm looking, September is kind of where my mind is. That's what I've relayed to the staff, because you have to look that deep, and then I think probably even deeper and walk your way back. Because there's one thing that we don't want is a resurgence of this. Or if people have seen it, the Murray curve, we've all seen, the curve itself and bend the curve, flatten the curve, but you can come out of it and then you go back up again at some point and you're on this roller coaster. We not see that. So our approach out of this is going to be, tiered. We tiered our way into it, phased, if you want to look at it that way. We're going to tier our way out of it. And once we know that we're flat and we remain flat, there are going to be several indicators that we continually look at. How many days since the last positive, whether it be in units, whether it be across installation, looking at those things. So those indicators, we already have them laid out. And then that's going to enable me to make the decision, okay, how do we phase our way out of this? How do we tier out of this? And keep everybody safe, because at some point, if you do a reemergence or a resurgence of COVID-19 and people kind of anticipate or predict, around the fall, you see it come back, and how can you reverse that very quickly so you don't, again, get into another steep climb? So I think it's going to take time. I hate to say it depends, but it's, we've laid it out, looked at the indicators. We continue to look at the indicators to see when we can get back to a point of, I wouldn't call it normal. We refer to it as steady state. We started at steady state. We've got to work our way back to steady state. Steady doesn't quite mean normal. It just means you're at a place where everything is operating as close to normal as possible.
Yeah, that's great. We've got a couple quick questions. You got time for a couple questions?
Yes, sure do.
Okay.
Sure.
Mike Adams. Hey, Mike, in reference to the local small businesses and contractors which support the post that have been issued a work stoppage, are there any future provisions to keep them in a ready state when the base resumes to normal?
Yeah, and I think I get the question. I think I understand. But as far as keeping them in a ready state, we have not, turned anything off. I mentioned some of the contract work that's occurring here now that comes out. As long as that provided that contractor has the workforce can come, and it depends on what type work that workforce is doing, then there are no restrictions on them. I mean, we easily look through those, evaluate them, reevaluate them, and come through. But in terms of, it sounded like the question was asking about preserving that particular type workforce. I mean, I don't necessarily think I can make a call on how that's preserved. Makes sense.
All right, that works. Thanks, Mike, for that. Got a question from a viewer who's got a family friend who has been accepted into the Army. With the changes in the high school senior year that's happening around the country and school being canceled, are there going to be changes that the Army puts in for new recruits?
If the question is about a diploma and those type things, I mean, they can still come in without that. I mean, however the high school works it to get them either a diploma later, and even if they don't have it, if they've already gone to a recruiter, taken the ASVAB test, all those type things, and met those prerequisites to come in, then the Army's school closures, those type things, some exceptions are going to have to be made. So if that comes up as an issue, I would first say, ask for the exception to the recruiter. If not, that person, if they want to, go through you to get to me to help them resolve it if that comes up as an issue down the road.
Gotcha. Great. How about this is one, I got a couple more from Mitch. How many soldiers typically are in a platoon and company usually, and will you decrease the number of soldiers per platoon moving forward?
Yeah, so a typical platoon size is 60. And so we've already reduced that down to 50%. What was coming in over the last few weeks only had us up to 30%. So 50% for at least several months is about the right number. So you reduce everything in half. If there's 60 in a platoon, that means there's 60 in the sleeping bay, which we reduce that to 30. Now you enable more social distance in the sleeping areas, the eating areas, and everywhere else. So yes, we've reduced it already. How long that stays in place won't really be a higher call with, training and doctrine command or the Army, but 50% at least for, the next several months.
Gotcha. There was a question about graduations being made up, but y'all have not canceled graduations. You've actually held them, and you're having them virtually every week.
Correct. So we do the graduations every week. We don't hold them up, don't postpone them, same day, same time as they would normally occur. On average, we're getting about 100,000 views, on those graduations, just with family members and everybody that comes up on the net that would typically be here to watch it, or at least about half of that here to watch it. Probably much less than half, about 3,000 to 5,000 would come, but many more family members and friends that, are watching it. And then I do a town hall every week, both for the local community, both for those extended family members that, have a soldier in training, as well as our workforce here on post. So anybody can tap into that on Facebook. We do them every Thursday at 15:30 just to get some updates on, what we're doing, our links to the community, all those type things.
Great. We will post that on our website for those that are on here that want to check out the town hall meeting with General Beagle. We'll do that. So General Dan Beatty has a smart aleck comment for you, but we'll reserve that for later when we're together.
Of course he does.
Yeah. Listen, you've been gracious with your time. We really appreciate it. More importantly, we thank you for your service and what you're doing for our troops out there. Anybody else? anyway, we just thank you for taking the time to be with us today. And we always enjoy being with you. So thank you very much.
No, Dave, thank you. And thank the community. I mean, for what the community does. And that's one thing I'm able to voice every single time I meet or see anybody, is just how much our community wraps their arms around our installation. Anything we need, we don't even have to ask. It's being offered before we can ask in a lot of cases. So it is truly appreciated. It is a very unique relationship that we have, and we're grateful for, you know, people like you, the chamber, everybody else that do all the things for us that you do. Because again, we consider we not only live in the community, we're a part of it, and we truly do feel that way. So thank you so much for what you do, and everybody that's on the net. Thank you very much.
You're what? Anything you need out there that the community can help you with?
For now, we're good. Honestly, we are really good. There's some things that are working again from the community in terms of, you know, hospital support, medical support, those type things that are already working. I mean, I won't spill the beans on that, but again, just more good news stories. I talked to the mayor probably 30 minutes before coming over here, so we always have our, you know, touch points and just kind of keeping each other in sync. And the thing I would never want to do is still, you know, decision space from somebody or have the same happen to me. But I cannot be more pleased with the transparency and the level of communication that we've had since I've been here. And I'm approaching, you know, 2 years, and that's been the same now since day one.
Well, I'm more excited that you're here for another year, which is a gift for us. So thank you very much. Listen, stay safe. Tell Pam hey for us. We'll talk to you real soon.
Will do. Thanks, Dave. Appreciate it.
See you later. Thank y'all, everybody, for being on. We appreciate it. We'll see you back on Thursday at 11 o'clock. So we look forward to catching up. Appreciate everybody's questions. Y'all stay safe. Wash your hands. See you.